Now let me introduce our esteemed guest today and let us start his talk. So we have, as I mentioned, Shri V.Srinivas with us. He serves as Additional Secretary to the Government of India, Department of Administrative Reforms and Public Grievances, with additional charge of Director General, National Center for Good Governance. He serves as India's representative on the Council of Administration of the International Institute of Administrative Services during the period of 2018 to 2021. Shri Srinivas has a master's degree in chemical engineering from the College of Technology, Osmania University, and has entered his 33rd year of distinguished service in the Indian Administrative Service. He has held senior positions in the Government of India and Government of Rajasthan, having served as Chairman Board of Revenue for Rajasthan and Director General, National Archives of India. He has represented India on the International Monetary Fund between 2003 to 2006 and the International Cotton Advisory Board between 2010 to 2013. He is a recipient of the Digital India Awards 2020 and 2016. He has published two books, 172 papers, and delivered 76 orations. He is a senior administrator, a respected academician, and an institution builder par excellence. The title of his lecture today is Transforming Our Future, Public Policy Solutions for Improving Quality of Life. Now, we have actually, sir, in our earlier distinguished lecture series, which Shri Chandrasekhar, he had actually talked about the AIMS project, and that is why we all have already heard about your work there. So in this lecture, I have already shared the presentation that you had sent. In this lecture, there will be a 60-minute talk that, sir, you will give. And after that, we will keep 30 minutes for discussion and question and answers from the students. So that is it from my side. Over to you, sir.
Distinguished faculty of the Indian Institute of Management, Visakhapatnam, Professor Neena Pandey, the chair and the director of the program. It's wonderful to come back to Indian Institute of Management, Visakhapatnam. I wish I was there in person. In fact, I have very fond memories of Visakhapatnam and the neighboring areas. My childhood was in Araku Valley when my father was posted there. And I had a year of schooling in Visakhapatnam. And both my parents were graduates from the Andhra University campus, from where the IIM currently functions. So, 2 months back, I think I recall visiting IIM Visakhapatnam and sharing some thoughts on the history of the service with the faculty. I'm glad that you've commenced the program, and the program on digital governance is a very exciting one, and it's a subject of great contemporary relevance. I did propose to Professor Neena many subjects for this particular distinguished lecture series, and some of them were relating to public finance, international institutions, as also with regard to administrative leadership, ethics, transformational governance. But the subject that she has chosen for today's discussion is titled Transforming Our Future, Public Policy Institutions for Improving Quality of Life. Let me share my presentation for today's lecture with you. I'll request the organizers to kindly put up the presentation. And the broad thrust is on how to develop digital institutions. I'm glad that Dr. Chandrasekhar had mentioned this particular subject in his speech. We've already had a distinguished lecture series from 2 former secretaries of information technology, as also an innovator who established the government e-marketplace. So I'll try and present to you as to what are the challenges that a practical administrator faces in establishing digital institutions. So the subject is Transforming Our Future, Improving Quality of Life. Please go back to the last slide. And it can be easily said that to solve the big issues of our times, we need to find solutions that matter. For improving our everyday quality of life, we need to focus on simplifying a citizen's journey with government. This is a message that has been given a number of times by the Prime Minister of India. In fact, even on 15th August, from the ramparts of Red Fort, he said, let us reduce the interface of citizens with government and build more and more digital solutions. So the program that many of you are undergoing currently is very apt in terms of taking the vision of the Honorable Prime Minister and of the Government of India in creating digital institutions and creating successful digital governance models. Personally, I found technology was a huge force multiplier in each of my steps in creating digital institutions. Next slide, please. It also is not simply, digital governance is not simply technology part of it. The technology is one part of it. It also needs to mobilize people with different skills and backgrounds towards one common goal of advancing the cause of public administration. You need to constantly re-engineer your institutions. You constantly need to learn new skills and unlearn the old habits. Everybody feels, oh, this has been happening in this manner and let us continue it. No. In terms of digital governance, creating new e-governance models, a lot of process re-engineering is required. Next slide, please. Next slide, please. So today, I'm going to discuss four broad sub-chapters. One is digital institutions. And as Professor Neena mentioned, I was the recipient of 2 Digital India Awards, and I'll present both the success stories. One is the Digital AIMS success story. The second one is the e-office success story. And I'll also present to you the, one more in terms of my tenure in state government as Chairman Board of Revenue as to how much digital governance can impact and benefit millions of India's citizens. And this has been done under the broader context of a Digital India program and how much digital governance can increase efficiency in decision making. This is something I wish to bring out today. And I wish to impress upon each and every one of you participating in this program that when you go back, please adopt digital solutions to re-engineer processes. That is one big advice that I would like you to take away from this session. Next, please. So as I said, I'm going to present to you a few success stories that I had witnessed in my tenure in the last 7 years, and a journey that I thought I should share with you because each of these has been highly recognized and has benefited millions of Indian citizens. These are digital AIMS, the digital Rajasthan Mandal, the Central Public Grievances and Redressal Management System, and the e-office. These are 4 e-office, e-governance solutions that I was part of. I'll also present to you a few more as part of the Digital India success stories. But let me present to you how digital institutions are created. Next, please. The objective is to ensure digital services for end-to-end service delivery. As Additional Secretary in the Department of Administrative Reforms, we supervise and conduct the National E-Governance Awards and the National E-Governance Conferences. I was very enthused to see that more than 750 nominations are filed every year for e-governance awards. Constantly, individuals are trying to rediscover as to how to improve end-to-end service delivery. And as digital infrastructure becomes the core utility for every citizen, we have high-speed internets, unique digital identities, access to common service centers coming in, and more services and governance services particularly are being available on demand. So seamlessly integrating services across departments and jurisdictions has become the singular challenge in terms of taking governance forward, and also to ensure availability of services in real time. So in many ways, what we have seen in terms of the huge scaling up in terms of our flagship programs in the last 7 years has been possible because rural societies accepted the change. And second, there has been a digital empowerment of India's citizens. So universally accessible digital resources, literacy, platforms for participative governance, these have been created, which have enabled this massive transformation. Next slide, please. Let me take you to the digital aims. And digital aims was a huge success story, and it has been documented in several books. Mr. N. Chandrasekaran, the chairman Tata Sons, has documented it in his book in a chapter where he has called Digital Aims. And Mr. Ram Sevak Sharma has documented this success story as part of his book called The Making of Aadhaar, how Aadhaar seeded services have enabled transformation. What remains is this was one of the first big Digital India projects which was implemented as part of the Digital India launch on July 1st, 2015. And the Digital Aims project is remarkable for simplification of a complicated hospital governance model of aims. Next slide, please. And it was feasible because of the synergy generated between the aims, the Ministry of Health and Family Welfare, the Department of Electronics and Information Technology, the National Informatics Center, and of course, Tata Consultancy Services. And the digital aims had benefited nearly 55 lakh citizens in the period July 2015 to April 2017. Today, it has been replicated in more than 490 hospitals across the country. It also has one of the largest footprints of Digital India projects and has received a number of awards for leadership excellence and has been cited by the Department of Administrative Reforms in 2015 to 17 period as one of India's most innovative projects. And several state governments have taken it up because it was implemented across all the central government hospitals, and it has to be gauged. In fact, the project's success has to be gauged in the background that it was implemented in one of India's largest functional hospitals, where administrative innovations can be easily crowded out by the challenges of day-to-day governance. So this was the reality check of 2014, and this has been documented a number of times. I've written about it in my book, The March Towards a New India, as I've already cited. There are 3 more books which have presented this particular success story, including the Chairman Tata Sons. 2014, when I joined AIMS, I found that it was really chaotic. 10,000 patients coming in every day, and it was difficult to reach a destination. 65 departments where OPDs were conducted, and there was an absence of signages. Patient journey in the hospital was really complicated. There was crowding at every counter, crowding at blood collection centers, crowding at registration counters, multiple registrations, elevator lobbies were crowded, on the stairs. There was a state of chaos, really. And it required massive process reengineering. And while the doctors and nurses were extremely driven and accorded highest priority to the patient, and the patients were treated as gods in the institute, the patient's journey per se was time consuming and exhausting. It took many, many hours, 6 hours to 7 hours to actually reach a consultation chamber. And today, when I visited AIMS, it had more than 15,000 OPD patients, but the journey has been far more smoother. And that was possible because there is digitalization of the institute. Next, please. How did this happen? And this was launched on July 1st. This was a portal that was launched, www.ors.gov.in. And when you log in today, you can get your OPD card online and you can go straight away to a clinician, because there has been tremendous transparency that has been brought about in the clinician's data diary, as also in terms of the patient's outreach to the hospital. The linking of Aadhaar numbers to the unique health identification numbers was the first step in the transformation. A patient can seek an appointment at AIMS by logging into the AIMS OPD appointment system, and he can submit a request for an appointment online, and he can get it with whichever department that is possible. And each of the 65 departments, the dates in which appointments are available are provided online. And the unique health identification number with Aadhaar seeding has given an individual digital identity to every patient visiting AIMS. And the patient can use the UHID for his entire lifetime, and every consultation visit is actually documented because each visit is placed on the digital platform. And you can transfer data from one hospital to the another in case you shift hospitals. And even if secondary references are required, you can easily share digital data across platforms. Next, please. How did this transformation happen? And a lot of it requires institutional managerial changes. And as I said, the first thing was reduce the patient wait time in the hospital. And that could be done by facilitating faster registration. So an online registration system eliminated a huge amount of waiting time. Secondary registration counters were abolished. Patient waiting areas were created. And thousands of signages were introduced, which enabled a huge change in that a patient could know where he could visit. And there was an introduction of screening at entry points because people would come in with huge number of attendants. It was normally allowed that one patient with one attendant would be brought in. And patient care coordinators, which was a new cadre that was introduced at the registration and consultation areas. And an exit OPD, which gave you when you had to come back. So your next appointment was already digitized when you left the hospital. So there were follow-up messages that were sent to the patient that your OPD appointment is scheduled for so-and-so date and you could please come in for a consultation. So a huge patient registration center was created with data entry operators and this ors.gov.in platform, and it simplified the registration system. I would see patients standing in lines from 3 o'clock in the morning. And once the digital platform was introduced, the whole process could be completed in something like 45 minutes. And a patient, even if he walked into the hospital without a prior appointment online, he could actually complete and reach a clinician's chamber in about 45 minutes. So it was a huge transformation. There are a number of films on this particular transformation that are available online. You could take a look at it. You could, of course, read these huge numbers of references that I've given you. Next, please. Process reengineering requires that you bring in new cadres, and we introduced nursing informatics specialists, nurses who understood how doctors' diaries could be maintained, nurses who could operate through a train to operate this digital platform, nurses who could streamline and bring in multiple departments online. So a cadre of nursing informatics specialists was introduced. Patient care coordinators who could guide the patients to the right areas were introduced. Data entry operators had to be put up at the patient registration counter. And the registration time was a mere 40 seconds for all new appointments. And we also created fast-track queues in case there were emergency patients, they could go through the fast-track queues. And the waiting time came down by nearly 6 hours per patient. So when I saw the data after 2 months or 3 months of implementation, what I found was that the All India Institute of Medical Sciences could actually handle double the number of patient loads as compared to what it was when it was a non-digital system. And there were no serpentine lines that started at 3 a.m. They had disappeared, and there were more orderly queues than there, and they commenced at 8, and things were far more orderly in the system. Next, please. So when you see the All India Institute of Medical Sciences was, this project was launched on 25th December 2016, if I recall. And one of the big areas was that how do we create patient-friendly hospitals? And I was quite overwhelmed when a colleague of mine said that the launching of the patient registration system actually could be titled as Saving the Titanic. In that here was a hospital which represented the best in healthcare, and adopting digital practices had brought in a massive change. And the then health minister's quote, I will read out here for you. The scale of involvement of the stakeholders in the transformation process was immense. It was a huge success story. I wanted to understand the benefits to the end person in the entire process. He kept coming there a number of times, as did the chairman of Tata Sons, who was then the CEO of TCS. Mr. N. Chandrasekharan was always there to explain the details to me. I made 4 visits to AIIMS to convince myself of the benefits of the change. And acceptability by AIIMS of the changes proposed by TCS was an immense challenge, and involving everybody was a huge task. So he further said that he would be replicating the success story in a number of hospitals. It was further spread across all departments of AIIMS. 65 departments were digitalized, and new modules like the radiology information system, picture archiving, communication, so that digital pictures could be placed online were introduced. As also a hospital of that size with nearly 5,000 beds needed new modules like the laundry modules, dietary modules, blood banks being brought online, and net banking facilities everywhere where you could make payments using kiosks, billing modules where you could get yourself discharged online. And lab data was interlinked with patient data. So the All India Institute of Medical Sciences, Delhi, became India's first fully digital public hospital, and it was a landmark event in June 2016. So as I said, the process of the OPD transformation commenced sometime in July 2015, and by December 2015, in 6 months' time, it was launched. And by June 2016, in about a year's time, the entire hospital became a fully digital institution. Next, please. This found mention and recognition in many fora. The scale of change and the success story found mention in the Honorable Prime Minister's Independence Day address on 15th August 2016. And it was recommended for pan-India replication, and many governments have replicated it since. Next, please. It also has been a recipient of a number of awards and recognized as one of the salient innovations of that period. But it requires huge amount of commitment and discipline to bring about change because systems can easily go wrong. And unless you're personally dedicated to play a leadership role to bring this change, it is not possible. The first day I recall when we tried it, it's not easy to convince a large population that this change is beneficial. People are used to continuity and are reluctant to accept change. It requires huge amount of acceptance on part of the citizens in case you want to create a digital institution. Next, please. The second one is the Digital Rajaswa Mandal. I was appointed as the 47th chairman of the Board of Revenue of Rajasthan. And the Indian Administrative Service is trained in land laws, and particularly as district collectors, subdivisional officers, we serve as officers who implement revenue law. And the implementation of revenue law necessitates adjudication of tenancy rights, adjudication of partition of holdings, protection of temple lands, protection of lands belonging to weaker sections, as also a huge number of supervision of a number of revenue records which are maintained by the Tehsil offices. Now, this is a legacy that has been there for the British Raj. In fact, the institution of district collector goes back well into the 1780s. So it's almost 240 years since the institution was established. The boards of revenue across India were established in mid-1930s to 1940s. The Board of Revenue of Rajasthan was established in 1940s, and it was established as an institution for Rajputana and central provinces. Next, please. Now, as I said, we have two critical institutions in our governance model, and particularly in state governments. One is the district collector and the other is the Board of Revenue. And successive governments have placed tremendous emphasis on improving justice delivery systems. And this is one area where there is a need for dire and drastic improvement. It takes over 15 years to decide second appeals in the Board of Revenue. And it also resulted in a huge amount of criminal litigation, which emerges from delays in adjudication in revenue courts. And the litigant is forced to take law into his own hands. So the interminable delays had become unfair to many litigants, and they would get stay orders, and it could take enormous amount of time to adjudicate. So an ICT enablement of courts required huge amount of process change, and that enabled a massive scaling up in terms of adjudication, monitoring of subordinate courts, as also transparency in dealing with advocates and providing judgments at the doorstep. So the Board of Revenue really had this huge number of cases, 5.74 lakh cases backlog in revenue courts, 1,500 revenue courts, and it took 5 years to be decided in a trial court, that is subdivisional officer court, and 2 years in the first appellate authority, and the board itself took almost 15 years, and the litigant's journey was 22 years. It required drastic measures to simplify a litigant's journey in a revenue court. Next, please. As I said, it's a very powerful institution. It represents the chief controlling revenue authority under all enactments in force. It's also the highest court of appeal, revision and reference as far as revenue matters go. Only the writ jurisdiction with the High Court exists. And it also has revisional powers. And it has tremendous amount of executive responsibility in terms of land records work, which is also, many of you would be familiar with the digital land records modernization program, wherein which the land records of the country are being digitized across every Khasra number in the country. Next, please. The Board of Revenue supervised two major acts, the Land Revenue Act and the Tenancy Act. And as I said, it is the state's job to protect land rights and ensure security of tenure. Rajasthan represented a particularly complex system in that it was Rajputana having separate multiplicity of tenancy laws. And when the state was created, many of these laws were integrated in one stroke into the Rajasthan Tenancy Act of 1955. So that resulted in a huge amount of complexity in litigation. And it took a huge number of years to actually decide that tenurial rights, particularly in a time when many acts of the state times or the princely states times were integrated into modern India's Tenancy Act. Next, please. So my first impression when I went there, it was a board which had 26 members, and it also had a tax board attached with it. And it was an institution clogged by huge caseloads, and it was not used to close supervision. And chairman largely lived out of the board's camp office in Jaipur instead of living at Ajmer, where the board had its headquarters. It was also a technologically obsolete institution with digitalization practices virtually non-existent. And manual supervision of caseloads and case status of thousands of files was an impossibility. Every day there would be more than 5,000 litigants visiting the revenue courts in the Board of Revenue, and more than 1,000 lawyers who would come to practice there. And very few arguments could actually be heard. Disposal norms were about 450 cases per month, and the institution was in need of radical reforms and transformational governance. And as I said, I'll show you how the caseloads could be. In fact, what does every litigant want? He wants timely disposal of his case. And it was possible to dispose 3 times the number of cases once digitization of the institution happened and process reengineering was taken up. Next, please. In fact, I found that in that period that I served there, the board adjudicated a decadal high of over 13,500 cases. And the pendency actually came down to 63,250 cases. The fundamental rule is conduct bench every day, do the simple things right. And once you sit on a bench, you decide cases. And the simple principles of good governance in a litigant's journey is timely case disposal. Next, please. So a 21st century vision for revenue courts of Rajasthan was envisaged after detailed consultation with huge numbers of advocates and, of course, consultations with Government of India. I do fondly recall my discussions with the then Secretary of Justice, who guided me on the immense benefits of digitalization of court work and the successful implementation of e-courts software in the Supreme Court of India. And that was a model that we replicated in what was called the Rajasthan Court Management System, the RCMS software. Next, please. There are also process reengineering issues. There are issues of jurisprudence that needed to be sorted out, expediting decision making, which needed constant monitoring of subordinate courts, as also the members of the Board of Revenue, deepening the technology impact, which I will share with you, and capacity building initiatives, particularly those of the young lawyers, because many lawyers don't want to argue cases and they're reluctant to argue before senior benches, and they needed greater confidence boosting to ensure that they would argue cases in the larger courts. Next, please. So these were the issues of jurisprudence that were taken up. I'll not go much into these issues because the subject of today's discussion is digital governance. Next, please. When you have a court with so many cases and hundreds of thousands of court record, it is important to streamline the registry and also to ensure that the benches are properly constituted and messages are sent out to advocates with regard to the cause lists well in time so that they do not evade the case saying that we were not informed or we could not check the cause list. So there was massive measures on streamlining the process of the registry. Each of the processes was brought online. For example, issue of summons. How many cases in issue of summons were there? How many cases were there for written statement? How many cases were there for arguments? How many cases were there for revision? How many cases were there for adjudication? Each of these areas was monitored and carefully digitized so that it became possible for consultation and also greater supervision. Next, please. We launched the digitalization of the Board of Revenue on September 27, 2017. And the first decision was that we will place all court judgments online. And every judgment that was pronounced by the board would be placed online and provided across 10,000 Gram Panchayats through the e-Mitra services. So that made a huge difference. Also, the cause lists were provided online across 10,000 Gram Panchayats. So the litigant was aware when his case was coming up. Very often what happened was, with so many litigants across a large state, the litigant is not aware when his case is coming up actually in the board. And he could see online when his case was coming up, contact his advocate and check whether there was progress in the case. We also launched what was called Revenue Courts Grid, which brought under one umbrella nearly 1,000 revenue courts. And today, almost 1,500 revenue courts, all the 1,500 revenue courts are online. So what was happening in each of the revenue courts was monitored. And the case status of each of these 5.74 lakh cases was available on e-Mitra platforms across 10,000 Gram Panchayats. So that made a massive difference too in terms of transparency of governance. Next, please. So what did it bring about? It brought about tremendous predictability and consistency in terms of court sittings. The chairman or the Board of Revenue as the supervisory body was aware of when the courts were sitting, when they were functioning, how many days they were functioning, and how many cases they were adjudicating. So greater monitoring enabled greater transformation. And the first principle of governance is what is not inspected is simply not done. And it needed a great deal of close supervision to ensure that revenue courts functioned in a predictable and consistent manner. Quality of judgment writing went up because we had huge numbers of workshops. And when you see a workforce where about 30% of the cadre is promoted from the Tehsildar service into the provincial civil service and not fully trained in terms of writing issue-based judgments under the Civil Procedure Code, huge amount of capacity building was required. And that kind of capacity building workshops were conducted. But there is also massive resistance, and it is not easy to digitalize an institution. And there was resistance in that the members felt that you would be creating an internet-rich and an internet-poor category of litigants. Those who had access to internet could approach the courts much faster, and the internet-poor litigants were deprived of it. But over a period of time, the acceptability of this change by the rural societies is something very important. Everybody welcomed the change. Thousands of advocates, thousands of litigants, and virtually all the revenue courts would be convinced that this was the right step forward. Next, please. So these are certain administrative processes. In terms of what is not inspected is simply not done, and get the basic work right. That is the essential practice of good governance. So if the bar is ready to argue a case, the bench should always be ready to hear them. Today, I'm told there are a lot of officers from the Income Tax Service, and those of you who have judicial or quasi-judicial activity, in case the bar is ready, you must always be ready to hear cases to ensure speedy justice. Next, please. So in terms of an impact, this was one of the most satisfying projects that I could implement in my career. And improved governance was possible because thousands of advocates, thousands of revenue officers responded to this call of let us improve justice delivery systems. And we find that it is sustainable. It has been replicated also across many states. In fact, many of these practices can be seen online and have been well documented as to how this reform has happened. Next, please. Coming to more recent times, e-governance in a pandemic. And e-governance in a pandemic, what we see as a massive change, when you look at how much the pandemic has changed our governance style, you find huge amount of systemic changes have come in. Next, please. The first is the public grievance redressal system, and I'll share with you the massive changes that have occurred in terms of how grievances are handled. It was also a time when the citizens approached government for redressal of numerous grievances. Next, please. So a separate dashboard, a national dashboard for COVID-19 was launched for public grievances on March 30th, 2020. And grievances were categorized into 11 categories, and each grievance was given a unique ID, monitored department-wise, state and district-wise. And the timeline for disposal was brought down to about 3 days. And constant review meetings were held with grievance officers across states and central ministries and departments. Press statements, infographics, and tweets were issued to ensure grievances were redressed on time. Next, please. Further, efforts were made to integrate state portals, district portals with CPGrams, which is the central portal. And more than thousands of officers, last mile grievance officers, were delineated in the top 20 grievance receiving ministries. We also operationalized feedback call centers across 10 cities, deploying 1,100 call center operators. And every citizen who filed a grievance was contacted on phone, whether he was satisfied with disposal or not. There was also ministerial interactions with aggrieved citizens through virtual conferences on the quality of disposal. And a number of times I've seen the Honorable Minister of Personnel interacting with citizens who filed grievances to check if they were satisfied with the quality of grievance disposal. Next, please. We got about 1.64 lakh grievances in the first phase of the lockdown in 2020, and 1.38 lakhs were disposed. And every citizen who filed a grievance was called, and about 68% of them said that their grievance was resolved within a time-bound manner. And of those who said that their grievance was successfully resolved, the satisfaction level was about 89 to 92%. And this was in the first phase of the lockdown. And the grievance redressal time we found was about 1.45 days. And it was much less than 15 days in state also, where we had to transfer the grievance. Next. The second is e-office, and e-office is quite a transformational change, and it is highly recommended that each of you adopt e-office in your systems. I did share a presentation of DGNIC on how e-office is being implemented across India. Next, please. The pandemic has necessitated less contact governance. We have to work in masks and gloves. Many of us are still working away from office, working from home. It did have short, medium, and long-term challenges as the nation got adjusted to getting back to work and living with the coronavirus pandemic. In fact, governance has been redefined in many ways. Next, please. So virtual offices have been operationalized. In fact, those departments which are not on e-office had actually to attend work in the lockdown. Web room meetings could be operationalized. There were new protocols needed for web room meetings. In fact, the digital central secretariat meant that attached offices, subordinate offices, autonomous bodies were brought online. And virtual private networks with huge security measures had to be deployed. In fact, deputy secretaries were authorized to use the e-office from residences. So that was the first time when VPN was delegated to deputy secretary level officers. And network security in home Wi-Fi environment was also closely looked at. Next, please. So today we have 75 ministries on e-office, and 57 ministries have achieved more than 80% of work on e-office. More than 25 lakh files in the central secretariat are available as e-files, and the number of physical files have come down to 9 lakhs. I do recall in 2014 as DG National Archives, we were looking at something like 45 lakh physical files. There were hardly any digital files. Today, the transformation, when you see, is less than 30% of the total central secretariat has physical files. So it has not only led to decluttering, but it has also led to creation of permanent records, which can be easily stored over a longer period of time. The Central Secretariat Manual of Office Procedure was revamped and restructured to enable the transformation to a digital Central Secretariat. Virtual private networks were created up to Deputy Secretary, as I said, and digital signature certificates were issued to up to section officer level. And functional web rooms have been operationalized. I've shared a longer presentation on this particular platform. And this was selected for Digital India Award because in terms of sheer scale, the implementation showed that a massive jump from 4 lakh files to 17 lakh files in that period of implementation. Next, please. So let me bring you to the larger policy issue. We've dealt with how individual digital institutions are there, and the approach is a whole of government approach. How do you create a whole of government approach? Next, please. The whole of government is a movement from isolated silos in public administration to networks and digital platforms. As I said, it transforms the way government works for the people to meet the increased demand on part of the citizens for personalized and accessible public services. Next, please. Next, please. So when you see governance across the world, everybody is focusing on digital. From United States to Australia, from Estonia to Singapore, virtually every nation is identifying on how do we make 21st century governance as a digital governance model. And if you have the social security numbers of the United States, where every individual has a digital identity, we have the Aadhaar numbers of India, where everybody has a digital identity. If you look at Singapore's public grievance redressal portals and you compare it with CP-Grams, you find similar models of governance. You look at the Australian model in terms of how the human resource management systems are conducted and compare it with India's EHRMS, we find similar models of governance, similar platforms which are operational. You look at the Estonian model of digital empowerment of citizens, and you find the Nagaland's model of digital empowerment of citizens. You'll find similarities across nations, across states, and everywhere there is a movement towards going digital in terms of governance models. Next, please. what made India's digital movement so vibrant, and that is the Digital India program. Next, please. So Digital India is the campaign to transform India to a digitally empowered society and knowledge economy. So high-speed digital highways to unite the nation. It stresses that government is open and governance is transparent. So a huge number of common service centers have enabled this transformation. Next, please. It has also enabled scaling up of programs. In fact, there's one big change that we've witnessed from 2014 onwards is saturation of programs and enhancing state capacity. That is what has happened. There's been a massive scaling up of programs. Number of e-transactions since the launch of Digital India is over 100 billion. Common service centers across the length and breadth of the country. Number of government services on Umang platform is 1,150. Jan Dhan accounts are witnessed virtually across every rural countryside. We have a massive digital consumer base, and the benefits of technology have been accepted by rural societies. Next, please. The technology progress is seen in welfare state programs. So the biggest is the direct benefits transfer, and I'll deal with it in the coming slides. I've already discussed the Digital India land records modernization program. I'll also deal with digitization of ration cards. I've circulated the One Nation, One Ration Card PowerPoint presentation to you as a specific one on that platform. Goods and Services Tax Network. Also digital payments, Aadhaar-enabled digital payments have become a reality. Next, please. One of the biggest game changers is direct benefits transfer, and the key enabler of a DBT has been Aadhaar. And Aadhaar-enabled payment systems have enabled beneficiary digitization. It has also eliminated deduplication of beneficiaries. There's been electronic transfer of funds. It has ensured data security, data privacy standards, and also enabled monthly reporting. So it has been a huge game changer in the manner in which government implements its welfare state programs. Next, please. You can see DBT in two manners. One is cash transfers and one is kind transfers. So in cash transfers, you have the social security pensions, there are scholarships, the National Scholarship Portal where so many scholarships, lakhs of scholarship monies are transferred to young students, fellowships, and then you have in-kind transfers like the two biggest subsidies that India administers have been streamlined. One is the food subsidy and the second is the fertilizer subsidy. It also required training and skill development, and 314 schemes have been onboarded onto the DBT Bharat portal, interconnected e-governance and social welfare delivery reform. So we can identify the beneficiary through the digital ID, digitized government processes, banking systems, and mobile connections. So Umang app is a huge game changer in many ways. Next, please. DBT in fertilizers. In fact, many of you are familiar how complex implementation of fertilizer subsidy was. It was first attempted, the fertilizer subsidy reform was first attempted in 1991. Thereafter, it was attempted in 2001, when every finance minister said that we would not finance inefficient fertilizer companies. We would like to transfer the subsidy directly to the beneficiary. And there's been tremendous amount of streamlining that was possible because DBT came into play. And DBT in fertilizers is complex. The beneficiary is not defined. And the farmer is identified on the basis of the Aadhaar or the photo identity card or Kisan credit card. And fertilizers are sold by government at subsidized MRP, and subsidy is paid to the manufacturer. And subsidy is paid on the basis of actual sales, which are captured on a POS machine. So it's been rolled out on a pan-India basis, and it has really transformed in terms of the way in which India administers fertilizer subsidies. Next, please. The second one, which I was very impressed with, is the One Nation, One Ration Card. 6 crore beneficiaries currently, 1.5 crore portability in transactions, and ration card that works at all fair price shops across India. It's similar to Aadhaar. You can walk into any fair price shop with an EPOS and authenticate the EPOS using Aadhaar biometric, and you can receive part of full entitlements. Family members can also access, and this biometric identification has been implemented across 26 states. And it is a massive technology-led reform of the public distribution system. Next, please. The third is the Passport Seva Kendra, and I've shared this platform also with you. And it is an end-to-end process overhaul, secure digital workflow, apply anytime, anywhere. You can apply from 488 parliament constituencies, 190 missions and consulates, and you'll get your passport at your doorstep. In fact, when I recall visiting the first visit to the Passport Seva Kendra at Hyderabad, the regional passport office, I found massive queuing. Today, you visit a Passport Kendra, you find that everything is systematized and streamlined to 4 counters, and the entire visit to a Passport Kendra is really a very seamless one, and paperless, cashless, and also it can be completed, the whole process can be completed in a single visit. Police verification has been simplified, and it has more than 2 crore online hits a day. Next, please. There's already been a presentation by Mrs. Radha Chauhan on the GEM, and GEM is really a one-stop portal wherein which the interface between the buyer and seller is through a digital platform. Procurement is one of the most complicated aspects of governance. And procurement reforms, by bringing in transparency, were much feasible because of GEM. And Rule 149 of the GFR has been amended to make procurement of goods and services by ministries mandatory on the GEM portal. Next, please. So here are some of the other innovations. India Post Payment Bank has made this vision of banking without banks a reality, that the postman delivers doorstep banking services. Digital land is a huge success story, particularly the Uttar Pradesh Digital Land Program has been a massive success story. E-pension, also Umang app is one thing we have already discussed. The Jeevan Praman portal, which is operationalized, wherein which life certificates are submitted online, has been a huge benefit for pensioners. Next. How do we evaluate India's e-services delivery assessments? And this is done through what is called a National E-Services Delivery Assessment Framework. And the first such assessment was released in February 2020. And after huge amounts of consultation and evaluation of over 1,000 services, and the Department of Administrative Reforms report is available online. Next, please. So e-services are evaluated on the basis of accessibility, content availability, ease of use, end service delivery, status and request tracking, information security and privacy, integrated service delivery. These are the parameters that go into monitoring India's e-services. Next, please. So the findings of NESDA 2019 show that in terms of integrated portals, Kerala was very successful in creating digitally empowered citizens. We also found Himachal Pradesh and Tripura, the smaller states, where there were a lot of successes. And in terms of individual service portals, next slide, please. In terms of individual service portals, we found Haryana and Rajasthan, as also Nagaland, doing very well. And you can go through the services, number of services that they're providing online, and how integrated portals have benefited individual citizens significantly. Next, please. In terms of central ministries, we have the Health and Family Welfare Portal was a big success. And today we have the COVID app, which could sustain and did not even 2.5 crore vaccinations were feasible under the COVID app in a single day yesterday. And almost 80 crore vaccinations have already been administered using this app. The CBDT portals have been very highly successful. And also the HRD Swayam portal has been very good. eShram of Labor and Employment, the EPFO portal is another one which is very successful. Environmental impact assessments of Environment and Forest Ministry have also been successful. Next, please. How does e-governance translate to increasing efficiency in decision making? Next, please. And it does translate in many ways. First, it has led to delayering. It has reduced the channels of submission. It has brought in transparency, particularly on e-office, where you cannot hide on an e-file. The delays are immediately known. You can immediately identify where the file is lying for how many days. And it has led to creation of flatter organizations. The second is operationalization of e-office version 7.0 has enabled interministerial reference making possible. And across the central secretariat, as I pointed out, more and more files are on the electronic platform as compared to physical files. Digitalization of central registration units has brought down the manner in which we handle dark. And in fact, in our own department, we found that we used to send physical letters to 33 lakh citizens who filed grievances. Today, all such responses are sent online. So it brought down our outgoing receipts by almost 33 lakhs. And digitization of central registration units has meant that DARC could be circulated to multiple stakeholders from a single portal very easily. And there was adequate documentation when the DARC was sent. And it also enabled operationalization of a desk office system. So in terms of increasing efficiency, the benefits of digital secretariats are very significant. Next, please. So what is the way forward? Next, please. The way forward would be to create simpler, innovative, and intuitive institutions that deliver good e-governance services. And for that, you need to create an inclusive digital ecosystem. You need to take all the stakeholders along and mandatory sector-specific services which are to implement India's flagship programs. E-literacy is very important, and improvising accessibility is needed for higher uptake. There's also a need for security and privacy in public data. And new age technologies have to be adopted for improved service delivery. So the big message is, as you go back, integrated service delivery with focus on India enterprise architecture is the roadmap forward. And please go back and try digitization of your institution. And whatever desk you're holding, try and simplify the processes by using digital reforms. Next, please. So a new India at 75, the new India 2022 would be a digital governance model. We have BharatNet, we have eTAL, eSign, DigiLocker as the backend interface, Service Plus as the front-end interface, MyGov in case you want to give ideas on governance. So this is really the digital model that will take India forward. As I said, the subject of whole of government and creating a one-stop portal is a great step forward towards establishing a whole of government approach. The portal per se doesn't guarantee an outcome, but it requires connecting all the e-governance systems, huge process reengineering, multiple stakeholders have to be brought in, new cadres have to be created if necessary. People have to unlearn old habits and bring in and adopt and accept new habits and new skills. Process reengineering is very, very vital, and you'll have to study the processes. And there exist substantial benefits both for governments and citizens from adopting a whole of government approach. So I think this is the last slide I have for you today. And let me also say one more thing, that we live in a world, I think we can close the presentation here. So we live in a world where everybody brings data to the table. And we trust in God, but in terms of decision making, we need to bring data sets to the table, and enhanced and improved quality of governance and quality of decision making are possible only when big data is processed in a streamlined manner. And that is what digital governance models enable. So thank you very much. This is what I have to share with you today. It also enables greater regulatory oversight in addition to handling big data. So I hope the message has been well taken, and I would be happy to take a few questions in this webinar. Thank you very much, Professor Neena, for inviting me to deliver this lecture.
Thank you so much, sir, for giving a very good overview of first starting with the 4 projects that you've been very closely involved with. and then giving us an overall view of what has been happening till now under Digital India and what we are going to see in the future. So it's a very good overall view for the students of the digital governance and program, governance and management program, and I'm sure for all of us also. Just today morning, actually, we had presentations from the students of the DGM program. The first batch of students are now, they have recently entered their capstone project, which is a big part of the program, where they are doing, they are looking at how can they use these digital technologies to improve the service delivery in their departments. So since morning, we have seen a lot of very interesting projects, all these words that you've been talking about, India enterprise architecture, plus in municipal corporations, a lot of such examples, such places where students are looking at. If they will not do the complete technical implementation, they are for sure going to give out a very good, strong design of how a particular aspect should be designed. And then probably as government goes to NIC for getting these things implemented, we hope to see contribution from our DGM participants also. Now I will just open up. Okay, I think Professor Shiv Shankar has a question. Before I allow you to ask question, all the students and faculty and anybody who is attending here, please, the forum is now open for questions. We will be now in the discussion mode for another 25 minutes. So yes, Professor Shiv Shankar, go ahead.
Yeah, first of all, thank you so much for such a great presentation. And I would also commend all the projects. That's a kind of a transformation that you brought to India overall. My question to you, sir, that it's all the success story per se, but what about the challenges? So particularly, like I am from the data science background and dealing with these kind of a projects, particularly with the government, what are the challenges that you might have faced or may be faced in future? So we as an academician can see that how theoretically or empirically or on the modeling basis we can see to solve those problems.
As I said, there's always resistance to change. Change is not easy to implement. And every time you try and take governance forward, there would be tremendous resistance because it's not easy to convince larger models, particularly large institutions with 30, 40,000 employees, to take forward and adopt change. It requires huge number of stakeholder consultations. That's the first thing. And first thing, one has to be convinced as a leader that you have the capacity to dream big and you will bring change. And to bring that kind of a change, you have to believe that digital governance is the right way forward. And you should have the resilience to take it to its concluding phase. There are multiple steps, and as I have documented, in fact, you must read my book, The March Towards a New India. A copy is available in the IIM Visakhapatnam library. And I have pointed out that there was massive resistance when we did the Board of Revenue digitalization. Also in the All India Institute of Medical Sciences, I was told many times, do not pursue it. We've implemented in one department. Don't take it forward across all departments because it's not an easy system to digitalize, bring so much transparency. And there are initial setbacks to any project because every project has teething troubles when you start, and it takes time to stabilize. New systems of governance take time to stabilize. The first day when we introduced a digital model in the Board of Revenue, I found that the advocates actually didn't get their cause lists on time, and they said that we're going to take 1 week off so that you can fix your systems. Similarly, the first day we digitized the All India Institute of Medical Sciences, I documented that we found that the security was totally overwhelmed because everybody was trying to rush in. So, it takes a huge amount of resilience to stick with an idea that you believe is right. And what I'm trying to convince is that when you study, even in terms of public grievances, I constantly believe that integration of portals, mapping of a huge number of grievance officers on the system, feedback call centers, as also improving categorization of policies, categorization of grievances was the right way forward. And it was the way in which a citizen's journey with government could be simplified. And when you study across all the 4 success stories that I have presented, what you would find the common thread is the citizen's journey in interaction with government is what has been the focus. Be it the patient's journey in AIMS, be it the litigant's journey in revenue courts, be it a citizen's journey in terms of handling public grievances. How do you simplify a citizen's journey in handling government? And that requires huge amount of empathy. It also requires huge willingness on part of the administrator to take on a leadership role to ensure that not only his organization, but also all the key stakeholders are convinced that the approach being adopted is right.
Thank you, sir.
Yeah, Professor Prince and Sanjay then.
Hello, sir. Sir, I just have 1 or 2 specific questions. So when you mentioned in case of AIMS, you initially started with 65 department. So was there any process followed for choosing these first 65? Was there any methodology was involved?
We started with 2 departments. The pediatric department and medicine department was the first 2 we started. Then we scaled up to 65 over a period of a year.
So how did we choose, sir? Like you go for the first, these 2 only I want to target first? Just wanted to understand the process.
Well, you identify low-hanging fruit, and Professor V.K. Paul, who's now the member Niti Aayog, was head of department of pediatrics, and he was the one who said that he would take it forward. And we also had a very distinguished head of department of medicine, Professor S.K. Sharma, who said that the patient loads in his department needed streamlining. So you identify what is feasible in the pilot phase, and then once a success story is established, then it can be scaled up over a period of time. So as you've seen, even in the case of the Board of Revenue, we digitized the board first, and then we went to the subordinate courts. We took up the district collector courts, the revenue appellate authorities, the divisional commissioner courts, then the subdivisional officer courts, then the last would be the largest one, that was the tehsil courts. So even in terms of the CP Grams portal, we took up the top 20 grievance receiving ministries first, now the next 40 grievance receiving ministries. States also and union territories, we integrated first with Jammu Kashmir. We tried a success story once, and then once a success story is established, it's easier to convince others that this is the way in which a citizen's journey can be simplified. Otherwise, it becomes very complicated when you take on too large a project. You cannot create a success story out of a very, very large project. You have to start it small, establish it, and then once the pilot is successful, take it forward. Even integration of district portals, I do recall, we started with 3 districts, Riyasi, Jammu, and Srinagar, and today it has been replicated across many districts of the Cape.
One was just last question. I know there cannot be any standard answer for this, but still, because you implemented so much of these programs and we are talking about a capacity building program. So on an average, how much time it takes for, those people who are working in the department to enhance that kind of capacity? How much time generally these people take, if you have to move from one skill going to some other skill? I'm just curious about these things.
It's a very interesting question. How long will it take to convince an individual that he should learn a new skill? My own experience has been that it takes about 3 months for the initial consultative process to be completed. And after that, another 3 to 4 months for the system to stabilize. So in about 6 months' time, an institution can be digitized. In case you want to scale it up in really large institutions, you require about 9 to 12 months' time. So this kind of transformation that we saw in terms of e-office took about a year and a half because it had 84 ministries and departments. It was a huge amount of work and more than 380 attached, subordinate, and autonomous offices. So I do, in terms of CPGRAMs also, I recall going for the first time to the Department of Posts and requesting them that they need to map more officers on the portal because grievances were taking a longer time to be addressed. And they were more than willing to adapt to the change being recommended. Stakeholder consultation is very important, and unless all stakeholders are on board, consensus is built, transformation is not possible. But one thing I found in interactions, I've worked in state governments, I've worked in the central government, and also in many international institutions. What I see is that Indian democracy needs strong institutions, and strong institutions are possible only when they are digital institutions where governance is transparent and government is open. So that is where digital governance is a very, very strong feature. And I'm a very strong votary of digital governance models, having seen e-governance being implemented in the Department of Administrative Reforms. We had handled it as a subject in the Government of India for now 3 years.
Thank you, sir. Thank you so
much. Thank you, madam. Good evening, sir. Myself, Sanjay Kumar Bhamra, student, PGP DGM, working in Ministry of Defense. So I really impressed. I am really impressed from the success stories you have mentioned, and I am acknowledging that we are getting good feedback to move ahead. But still, I have certain submissions. First is that success stories all related to the pilot projects, and approaches are almost same, top-down approaches, and we know that data at a pilot level, pilot project are showing data will shoot up. The country like India, when we implement any pilot project, data will shoot up. But in the national level or state level, we know that there is not a substantial change in the data. When we talk about the people, when we see the bottom-up approach, so data are not showing the substantial improvement in India. Last 10 years, when we see that JAM or other things, the state size is shrinking, and it is not shrinking that because we are implementing digital transformation and we are efficiently working, but it is shrinking because our government organizations and state is not efficiently working. So these things are a little bit contradictory. You may throw some light on this.
As I said, decision making, 21st century decision making is quite complex. It's not easy. And it's far more complex than what 20th century decision making has been. Of course, there are foundational values, a commitment to the larger public good against all odds that remain a constant feature. But there is also a need to bring in robust data sets. And as I said, in God we trust, but everybody else brings data to the table. And data collection, data collation, and also analysis is required for considered decision making. And that is only possible when the web portals or departments are updated. They provide a constant stream of highly granular data that is available, also in terms of historical documentation when it is available. We just had a question from a senior faculty as to how, what is the challenges that are faced. They have to be documented in terms of availability, the historical data of experiences. You would recall standing in a line to get a railway ticket, and I recall standing in a line to get a railway ticket. It would take 3 hours. So today we don't need to go and stand in a line to get a railway ticket. We get it online. So digital systems are definitely the way forward. Stronger integrated websites providing services are the way forward. In fact, the Department of Defense has recently, in collaboration with the DRPG and the IIT Kanpur, has streamlined the manner in which their public grievances would be addressed, particularly a huge number of service grievances coming from major cantonment areas. And they have introduced a keyword search, and also in terms of artificial intelligence and machine learning, a number of new techniques have been introduced on the Department of Defense portal, and so that they can reach out to a larger number of audience on a more systematic manner. But the way forward is digital governance, and Aadhaar-enabled governance, particularly in welfare state programs, has been a game changer. The reason why I pointed out many institutions which are Aadhaar-based is the importance Aadhaar has brought into governance models has been quite significant. And that is also the model that all countries across the world are following. So as I showed you, be it the social security numbers of the United States or the Aadhaar numbers of India, there is a similar pattern in terms of governance models across the world.
Thank you, sir.
Good evening, sir. This is Vimal. It was a very nice presentation and a lot of insights into the digital projects. I had one small query for the benefit of the community. Sir, we have been implementing a lot of these digital projects, particularly in critical systems like hospital management. And we are also seeing a lot of attacks, cyber security challenges. How did you manage those kind of things? How did you address such challenges in these projects, and what are the possibilities that?
Can you just repeat it? I
Yes, sir. Yes, sir. For example, digital aims. Now everything is digital, and we know that when we make everything digital, there is also a possibility of cyber attack. For example, a ransomware attack. And when we have that, they might block the entire management system, and hospital management. When it is digital, it is very critical because we have to serve the patients. We might not be able to access their historical records and all. So when we are digitizing such projects, what are the precautions we need to take in terms of the security, in terms of the managing such systems?
Yes, it's very important question. Cybersecurity has been a very key feature of digital governance models. Today, there are two-factor authentications that are introduced on most of the platforms. For example, even to file a public grievance, you require two-factor authentication. Even when I access my own email, there is a two-factor authentication that has been introduced. So multiple security protections have been introduced, and cybersecurity has been a key feature of India's digital governance model. In fact, let me just read out one small para in response to the earlier one. What are the challenges you faced in terms of digital governance? And this was a para I found from my book. As I initiated efforts to digitize the Board of Revenue and Subordinate Revenue Courts, I was often confronted with numerous officials pointing out the difficulties in the use of technology in litigation. There were fears expressed that there would be two classes of litigants, the information-rich litigants and the information-poor litigants. The registrar opposed digitization, members opposed digitization, lawyers didn't seem enthusiastic about digitization. There was little political support for the technological advancement in the Board of Revenue. The biggest challenge was acceptability. I presented the members, the registrar, the advocates with the successful implementation of the digital aims and the immense benefits accrued from digitalization of India's FX public hospital. Individual discussions were held to ensure greater acceptability. I staked my personal credibility to push ahead with steely determination on a seemingly impossible climb. Then it happened. A diverse group of stakeholders converged for the first digital revolution in revenue courts of Rajasthan. In fact, when we digitized AIMS, it was called the first digital revolution in healthcare in Rajasthan, in India, healthcare in India. And this was the first digital revolution in terms of revenue courts of Rajasthan. It takes huge amount of effort, trust me, as one who has gone through it, and it requires multiple stakeholder meetings to bring it through. Cybersecurity is a vital component, and the only way it can be handled is through multiple factor authentications before you log into a system.
Thank you, sir.
Amit and Shiv, anybody?
Yeah, good evening, sir. I have two small questions and I will ask in one go and you can answer one by one. So my first question is that there are some government initiative which is great success, like mobile payment or e-payment. There are some government initiative that did not get that much of success. So customers are accepting changes. They are not showing a status quo what is some of the innovation. So where is the problem that some innovation is getting huge success, some innovation is not. So where is the problem? That is my first question. And second query is that how you find it challenging or easy to take the support of third party in implementing or developing these kind of innovation.
When you bring in a third party, an outside the system player into the system, it's quite a steep climb for him also to understand how government works, because government is very process driven and governance models have been established over several decades. So when you bring in an outside player into the system, for him to re-engineer and understand the process, it takes its own time. So there is a certain time lag into the entire process that a third party brings in. Of course, NIC is our knowledge partner in terms of developing e-governance models, and the states have their own IT departments in the states which are familiar with the process of governance. But if you bring in a third player like TCS into the system, the AIMS model did bring in the TCS into the system. They take time, but they came up with very substantive changes. The first question was some, can you please repeat?
Yeah, first question was, sir, ki some of the government innovation got huge success and acceptability rate is very huge, but some of the government innovation is not getting that much of success. So consumer is ready to accept that, we can say, but where is the problem, sir? Where we are missing that acceptance?
It needs greater outreach. It needs greater outreach, and also it needs greater push. For example, the e-hospital project of AIMS was there for a long time, but only few modules were taken up. As I said, individuals can make huge differences to institutions. And when an individual pushes a particular digitization project forward, it can make a massive difference to the system. As I said, there are surely currently 44 mission mode projects that are being taken up under the National Mission on E-Governance. And each of these is pursued, monitored at great vigor. Even in states, there are projects that are taken up. I do recall Bhamasha was one of the big projects that was taken up by government of Rajasthan in terms of a major digital financial inclusion scheme. But it took time to stabilize, and you need greater outreach for programs which are in their nascent stages so that they can stabilize and they can be taken forward.
Thank you, sir.
Good evening, sir. My name is Shiv Gupta. I'm a student of PGP DGM batch. Sir, first of all, tremendous amount of work has been done by the entire government sphere here in e-governance. And I've also been fortunate enough to be a part of the lecture series at NCGG, wherein delegates from Myanmar and Bangladesh also come. So my question is that, do you think it is practical now for India to look at officially making models wherein we extend our support to neighboring and underdeveloped countries? Because this question is arising from a conversation I was having with one of the officials from Uganda, where they wanted to really know about common service centers as a model. And so CSC itself is first of all, we have done so much work that they all are in a case study level examples that we have worked on. So DARPG or any other ministry, in what official capacity can we look at extending proper support to underdeveloped countries? And is it even practical to look at it at this stage?
Yes, very practical. In fact, there are multiple levels in collaboration being extended. Recently, we had one major interaction with the Republic of Sudan, and the Minister of IT and Digital Communication of the government of Sudan was online with almost 350 officials from Khartoum, and it was an online presentation on how a whole of government approach would be implemented and what were the projects that can be successfully implemented. He's sending a delegation to study how the Aadhaar-enabled payment systems and e-governance models are being taken up. You're right that in the presentation that I had shared with you of DG NIC, there is a collaboration with Sri Lanka on implementation of e-office. So there is huge enthusiasm, particularly in African countries, our neighboring countries, on how we have digitalized our institutions. You see the Andhra Pradesh Secretariat itself, it's a major change in terms of implementation of e-office. It has one of the highest users in terms of e-office instances. And I think the Andhra Secretariat represents a major step forward in terms of digital governance for a state secretariat.
Thank you, sir.
Yes, Uttam, please go ahead with your question.
Thank you, madam. And thank you, sir, for this great presentation. I'm a current batch of PGDM, and we are learning great, exciting things in this course, sir. Let me share with you. And we have a brilliant faculty, and we are excited to see that a lot of thinking is going on through digital means in the country. And of course, digitalization is empowering. I come from EPFO, and I myself have experienced that in last few years, EPFO through digitization has been able to reach out to the citizens in a very convenient manner. In fact, during the COVID period, we were able to handle more than 50% extra workload as well. Nevertheless, across the world also, the digitization has been helping countries. And as you spoke of government-wide whole of government concept, and we working on this. In our country, how soon or in what time frame do you see the concept of a government-wide CIO coming into practice or on a policy front? Because in today's class also, one of our MIS classes, we were discussing about how a CIO would be able to provide and coordinate policy leadership, will be supporting and monitoring open government institutions and coordinating IC projects. Thank you so much, sir.
I did mention the EPFO as a major success story in terms of the digital portals that they're maintaining, and that's what made Labour Ministry so high in terms of the Ministries of Government of India, where digitization projects were successfully administered. The concept of a CIO is already in place, if you see, because every ministry has a senior technical director or deputy director general of NIC in place, and large NIC teams are working there. It can be further strengthened in case you need higher digital systems or you need more AI and ML practices. The number of NIC staff or the manpower that works with the senior technical director can be enlarged. In fact, I noticed that across India right now, the most successful companies are those which are implementing digital platforms. TCS has advertised for thousands and thousands of recruitments in the current year. And this is a major area where manpower requirements are being felt. So I'm sure we'll see a CIO coming up in the coming days through the NICM, of course.
Thank you so much, sir. I think the time is up. Unless someone has a pressing question, we will move towards closing the session.
Ma'am, this is Kiran. Can I ask a question, ma'am?
Yes, Kiran, maybe a question is for you.
Sir, very good evening, sir. Thank you for the presentation, sir. It was very much useful for me. Sir, I have a question regarding NESDA, sir. So where you mentioned that, sir, there are 7 parameters, and in which we can also see content availability is the second one. And sir, regarding this one, sir, for example, recently Telangana government has launched one Dharani portals which is related to digitization of land, sir. And coming to this point, sir, content availability, and government should see that the content placed on the website should be complete, and it should be very much accurate, sir. And this is missing. And for example, in this parameter, if the government gets a low ranking, and to get the better rank, so they cannot wait until next year, no, sir. So how soon are we checking the ranking again, sir? Is there any time period, sir, apart from 1 year?
The NASDA surveys are currently being taken up, and 2021 will be the National E-Services Delivery Assessment. 2021 is currently under formulation. The Telangana model is very good, actually. The Dharani model is very good in terms of linking registration with mutations. And I do recall the Chief Secretary, Government of Telangana, mentioning how much of a forward-looking step this has been, because it is one of the few states where mutations process has been linked with the registration process.
I agree, sir. But there are some points like where government is not at all focusing, sir, because even I've been checking the site since the day of inception, sir, since as a PhD DGM student, sir. And coming to this point, sir, wherever any link is required, they're not placing that. So for example, if someone's land is under prohibited list, sir, and they're giving references others, and in other column I mentioned that some letter from department ABC/2012/ABC, sir, and to get the particular letter, so someone has to go like so many weeks to get that particular department and to find out the particular officer and to get the letter, sir. And if the government has the letter already, they can place the letter on the website itself, so it will be useful for the whole village, sir, actually, not for one person.
What you're saying is perhaps it could be sent as a suggestion to the Principal Secretary, IT, Government of Telangana, so that he can follow up on this point. Sounds good. Sounds good.
Yes, sir. The only thing I did was, sir, I had sent multiple mails to my collector, sir, but there was no response. Even I went there physically to NH office also, but no one was listening, up to the mark. They told that okay, it will happen soon, but it has been occurring since months, sir, since like February, I think so. And with this few points, sir, maybe it may also get a lesser ranking.
Let's see how it fares.
Okay, I will just ask Shiv to give a vote of thanks for the talk. He is a student, as he has already mentioned before. Yes, Shiv, please.
Well, respected sir, it's a privilege that we
Can't hear you, Shiv.
Am I audible? Am I audible now?
Yeah.
All right. Thank you, ma'am. First of all, respected sir, it's a privilege that we as IIMV students are getting to attend your session, and specifically under the distinguished lecture series. Thank you for your presentation that was filled with so many examples of innovation ranging from banking services, digital land, Umang, specifically about the National E-Service Delivery Assessment Framework and COVID countermeasures. CP-Gram itself is a revolutionary work. So beyond this, everyone is aware about the digital awards that are much sought after, conducted by DARPG. In discussions like these, we get to hear from your institutional memory, and that is one of the USPs of these talks that we get to attend to. And first of all, lastly, I would like to express a sincere word of thanks and deep sense of gratitude for spending so much time with us. And lastly, sincere thanks to the chair and program office for organizing this series. Thank you.
Thank you, Shiv. Thank you, sir.
Thank you very much. Thank you.
Last comment. Yeah.
Coming back to IIM Visakhapatnam is always has a lot of personal memories. Thank you for inviting me. It's a great privilege to speak at this esteemed institution.
Thank you, sir. Thanks a lot.
Thank you so much, sir.